Hello everyone. Today our topic of discussion is to evaluate the effectiveness of point of care ultrasound versus chest X-ray in diagnosing thoracic conditions based on clinical evidence and evidence-based trial. So let's start our first topic. So we'll start with our first study, which was done in 1997 and published in American Journal of Respiratory Critical Care Medicine. This is the source. The objective of this study was to compare the effectiveness of lung ultrasound, chest X-ray, and physical exam in diagnosing ARDS. 32 patients participated in the study who had ARDS. So patient underwent physical exam, chest X-ray, and lung ultrasound, and the findings were compared to the and later confirmed by CT scan. So what were we trying to measure? We wanted to test the diagnostic accuracy of each modality, that is ultrasound, chest X-ray versus physical exam. What was the result of this study? Lung ultrasound has a diagnostic accuracy of 93%, which is higher than the chest X-ray, which has the accuracy of 47%, and physical exam has the accuracy of 40%. So the conclusion based on this study was that lung ultrasound is a reliable and superior tool for the early diagnosis of ARDS compared to chest X-ray and physical exam. The next study was done in 2011, published in ICU Journal, Intensive Care Medicine Journal in 2011. This is the source. What was the objective of this study? It was to compare the diagnostic performance of lung ultrasound and chest X-ray in detecting common pulmonary pathologies in critically ill patient or patient who are in ICU. So 42 patients, they participated in this study and they are mechanically intubated. They were on vent and in ICU. Sensitivity and specificity for detection of pneumothorax, pleural effusion, and consolidation and interstitial syndrome were performed. So patient underwent lung ultrasound and portable chest X-ray, and the findings were compared to thoracic CT, which was the gold standard. And these were the results. So lung ultrasound had a sensitivity for the pneumothorax detection. Lung ultrasound has a sensitivity of 100% and specificity of 78%, but the chest X-ray has a sensitivity of only 52% and specificity of 100%. When we look at pleural effusion in critically ill patient, lung ultrasound has a sensitivity of 94% and specificity of 98%, but when we look at the chest X-ray, the sensitivity is only 65% and specificity is 81%. When we look at alveolar consolidation and interstitial syndrome, the lung ultrasound showed higher sensitivity and specificity compared to chest X-ray. So the conclusion from this study was that lung ultrasound is more accurate than chest X-ray for diagnosing pulmonary condition in critically ill patient and can be a valuable tool in ICU setting. The next study was published in American Journal of Emergency Medicine in 2011, and the objective of this study was to assess whether POCUS improved diagnostic accuracy compared to chest X-ray in ER setting when the patient is presenting there for shortness of breath. 404 patients, they participated in the study and they were coming to the ED for acute shortness of breath. All the patients, they receive both POCUS and chest X-ray in the ED, and the final diagnosis were established by an expert panel after viewing all the clinical data and imaging. So they were looking for the diagnostic accuracy for condition like heart failure, pneumonia, and pleural effusion, and using POCUS and chest X-ray. And these were the results. In terms of heart failure diagnosis, POCUS sensitivity, point of care ultrasound sensitivity was 97% and specificity was 95%. But when we look at the chest X-ray, the sensitivity was 65% and specificity was 80%. When we look at pneumonia, the POCUS sensitivity was 95%, specificity was 90%. But looking at the chest X-ray, the sensitivity was 60% and specificity was 85%. When we look at the pleural effusion, POCUS detected more cases than chest X-ray. What was the conclusion? So POCUS outperforms chest X-ray in diagnosing the causes of acute dyspnea, and it led to more accurate diagnosis, and the timely management was started in the ER setting. More accurate diagnosis and the timely diagnosis was performed by POCUS. Our next study was published in Chest Journal in 2005. The title of the study was Accuracy of Transthoracic Ultrasound in Excluding Post-Interventional Pneumothorax and Hydropneumothorax. What was the objective? The objective of this study was to evaluate the accuracy of POCUS versus chest X-ray in detecting pneumothorax after any intervention, transthoracic intervention. 367 patients, they participated in this study, and they were undergoing transthoracic procedures like biopsy or drainage or central line. It was a prospective study. Post-procedure, lung ultrasound and chest X-ray were performed, and then CT scan was used when the results were inconclusive. Sensitivity and specificity of POCUS and chest X-ray in detecting pneumothorax were performed, and these were the results. In terms of pneumothorax after post-procedure, POCUS sensitivity was 100% and specificity was 99%. But when you look at the chest X-ray, the sensitivity is only 52% and specificity is 100%. The time efficiency was also there because POCUS provided immediate result, reducing delays in patient care. Our next study was point of care ultrasonography in patient admitted with respiratory symptoms. So this was published in Lancet Respiratory Medicine. This is the source. What was the objective of this study? The objective of the study was to determine whether addition of POCUS to standard diagnosis workup improved diagnostic accuracy and patient outcome in adults with respiratory symptoms. It was a single-blinded, randomized control trial, and 320 patients, they participated in the study who were admitted for respiratory symptoms. So patients were randomized to receive either standard diagnostic test like chest X-ray or standard test plus POCUS. So these were the results. The POCUS group had higher rate of correct initial diagnosis, 88% versus 63% in the control group. Also, the time to diagnosis, the median time to reach a diagnosis was significantly shorter in POCUS group. So overall, POCUS led to the change in management decision, reducing the need for further imaging. So based on this discussion, we can say that point of care ultrasound is very helpful in diagnosing lung condition much faster compared to chest X-ray. It can lead to more accurate diagnosis and improve patient care. Thank you very much. Have a nice day.